Here's part 2 of muscles. In this case, where you're still working on muscles of facial expression, and we're dealing with everything connected to the facial nerve. Okay, so the next thing that we take a look at, we've just discovered how to raise our eyebrows, how to close our eyes, how to close our mouth, and how to smile. We got those down pretty well. Okay, so we're going to skip over some of these. You can learn them if you like, but it's basically I'm going to try to just teach what is within the scope of the undergraduate course and not get too hung up on too many details. And I am going to go slowly, though. Okay, again, we did notice that the Orbicularis Oris, it's going around the lips of the mouth and so on, arising indirectly from the maxilla and mandible. It is definitely encircling the mouth, inserts into the muscle and skin at the corners of the mouth. We're going to be closing the lips, pursing the lips, protruding the lips, so that there is a kissing type of action that can occur there. Whistling is also possible. Okay, obviously, if you're playing an instrument that requires wind, like a trumpet or a trombone or something, you are going to be having very strong musculature in this region. And then, again, the facial nerve. Okay, then Buccinator. Buccinator is sort of, how shall I say, it's a deeper muscle in the cheek, and it's thin, horizontal, it's flat. It's mostly used for the wall of the cheek when you're chewing food and things like that. Okay, it's beginning, the origin says here is the molar region. It's further back in the mouth of the maxilla and mandible, and we're going to be going to the Orbicularis Oris, that is to say, down to the musculature of the lips and so on, right? And we're going to compress the cheek. This muscle is used when whistling, when sucking a straw. It is a sort of a trampoline action. It holds food in a particular position so that with the use of your tongue you can position the food for chewing and that sort of thing. There's people who develop what's called embouchure, which is to say, again, that there's wind instruments that employ musculature of the lips and the cheek so that these muscles get rather strong for these individuals. Then we have the famous Platysma muscle. I have a story that goes with this, but it's a little bit ribald at the moment. I was tested at one point by a professor who wanted to see if we could, who was going to be the star teacher for the lab, who was going to get more labs. But at any rate, the way they list it here is that it's the muscle that is beginning, they say, at the pectoral area, and then it's going to the lower mandible, and that it actually depresses the jaw. Okay, so tensing the musculature, or the skin of the neck, I should say, helps depress the mandible, pulls the lower lip back and down, but in the facial nerve. I was I was tested by this muscle one time, or by a professor who asked about how do we move, how does, how shall I say, a burlesque dancer move the mammary glands in a certain way when doing fan dancing. So that was the sort of ribald test that I was being given, and I was competing with two other people who were trying to get labs to teach as graduate students, and so they were trying to figure out how would a dancer cause her breasts to move when the rest of her body is absolutely still and when she's holding a fan in front of her face. And they guessed pectoralis major, I guessed platysma. And the reason I guessed that is because it's the only muscle that goes to skin overlying the chest. And so I got 4 labs to teach as a result of that. But if you look in your mirror and you try to contract this muscle, it's actually quite how shall I say, a definite look, shall we say. So that's why a fan dancer might actually put a fan in front of her face when she's contracting this muscle. So at any rate, this is also a muscle of facial expression. And when you're contracting it, go ahead and try to do that, if you will. I've never been able to control my own breasts with this muscle, although I've tried often and looked in the mirror and saw what I could possibly do with this muscle. But at any rate, it's a very substantial muscle. It's very difficult when dissecting cadavers to avoid injury to this muscle. It's very embedded in the skin itself, and so what you'll see is there's something that almost looks like a cobra. When you're contracting the muscle, it gets very wide and becomes very distinct in the neck region. Okay, so there is that. And we're going to press on now, and we're going to consider another set of nerves here. In this case, it's the mandibular branch of trigeminal nerve. So we learned briefly about nerves going through the openings of the skull. Do you remember that? And we had the ophthalmic division 1 branch of trigeminal going through the superior orbital fissure. We had the number 2 branch, the maxillary, going through the foramen rotundum, and then through the foramen ovale we had this one, the mandibular. The mandibular comes down, actually. It comes down through the foramen ovale, and it comes down and it actually enters the jaw. It enters the jaw and innervates the teeth. But on the way down, it's also sending out branches that innervate the muscles here, or I should say here. So let's consider these muscles. These are muscles of mastication or chewing. Okay, we have 4 of them. We have the masseter, we have the temporalis, we have the medial pterygoid, and we have the lateral pterygoid. Okay, and specifically, let's take a look here at the origin of temporal or temporalis. Temporalis starts up here on the temporal bone. There's a fossa. The muscle arises from that part of the skull. Do you notice that it's actually going behind the arch? So it doesn't actually touch the arch. It goes behind the arch. And then basically it's going to the upward process right here, the coronoid process, which is not well demonstrated. Okay, so you would have to have your own skull, I think, to see this really well. Here's the coronoid process, which is the articular process, and then there's the coronoid. So this is pulling up, and it's elevating the jaw, so you bite into something with temporalis. That's the work of this muscle, temporalis, fan-shaped. Origin is the temporal fossa. Insertion is the coronoid process of the mandible. It's going to close the mouth, close the jaw, elevate the jaw, and it also does retraction. You might recall that we can actually pull the jaw back and have that sort of sense of fear or surprise with that retraction of the jaw. The other one here that's working synergistically with it is the masseter. The masseter starts right here at the zygomatic, and it goes down to the angle. And again, it's also elevating the jaw, closing the jaw so that you bite in. These 2 muscles are for biting in to the food and using your incisor teeth. Then we have deep. We have these pterygoid brothers here, lateral and medial, and they're actually going to the inside of the mandible and making it work from side to side. So they're more about grinding actions. Okay, so here we have these guys right here. We're going on the inside of the mandible, and it provides forward sliding and side-to-side grinding motion. You can protrude the jaw. Okay, if you do protrude the jaw there, you're going to be looking very determined. Okay, and so that's in the province of the medial pterygoid. Lateral pterygoid is going to also provide forward sliding and side-to-side action, so they are very similar in their actions. Okay, so the four muscles of mastication, just the way you like it.